Thank you, Deputy Speaker. I rise today to speak on this important motion because mental health is one of the defining challenges of our time. It reaches into every home, every school, every workplace, and it's something that government simply cannot afford to get wrong. We all know someone who has or is struggling. It's the young person who can't get the right support at school, the parent quietly carrying a heavy burden, the colleague who suffers in silence. Deputy Speaker, our country is facing a mental health epidemic. According to the ABS, around 1 in 5 Australians experience a mental or behavioural condition each year. Rates of psychological distress have never been higher, and yet access to help has never been harder. Despite billions in federal investment, outcomes are going backwards. Children are waiting months for appointments, families are being pushed to breaking point. Communities are crying out for help, and under this Labor government, the system is going in reverse. Deputy Speaker, the system under Labor is completely backwards. We saw it when Labor cut Medicare-subsidised psychology sessions in half, a lifeline that thousands of Australians relied upon. They took away something that was working, leaving vulnerable families to fend for themselves. In my own electorate of Macpherson, the need is undeniable. Nearly 8% of locals live with a long-term mental health condition, and more than 1 in 5 report a mental or behavioural disorder. Behind each statistic is a person, a family, or a community trying to hold it together. Deputy Speaker, as you will well and truly know, in this role we have the opportunity to meet with people from across our community, to hear their stories, to understand their experiences, and then ultimately to represent them here in this place. Soon after I was elected as the federal member for Macpherson, I met with a local family from Palm Beach who spoke to me about the fact that they will never forget the day that their world fell apart. A father who had been battling depression attempted to take his own life. He survived, but the impact on his wife and his children was immense and remains to be the case. When he was released from hospital, he wanted to rebuild, he wanted routine, he wanted connection, and he wanted a sense of purpose. He tried to find a part-time job, something small, to get him back on track. But under Labor's welfare system, the moment he earned a few dollars, his support was cut off entirely. Deputy Speaker, this is what I mean when we say Labor's policies are backwards. We know that work, routine and social connection are some of the best ways to support recovery and mental well-being. Yet Labor's system punishes people who try to do the right thing. It traps them into dependence rather than helping them move forward. Why would this Labor government design a system that disincentivises Australians from beginning their journey to ease back into working, contributing and reconnecting? Why don't they trust Australians to make their own choices about gradually transitioning back into work and community life? If they had their own way, no one who had been disadvantaged would ever get a fair go at getting back on their feet. I'm reminded of another one of my constituents, Mr Deputy Speaker, a single mother whose daughter had been dealing with mental health challenges for some time. When Labor halved the Medicare-subsidised psychology sessions, it left her in an impossible position. She simply cannot afford the extra cost, and so her daughter goes without. Australians deserve better. They deserve a system that meets them where they are, with compassion, flexibility and trust. And it would be remiss of me not to mention the fact that this mother spoke to me about the difficulties that her daughter has in accessing mental health support services because of the unique situation they were in, where her father attempted to commit suicide and thankfully was unsuccessful in doing so. Because of that, this person was unable to access support that was needed. Australians, as I said, deserve better. But under Labor, their services are cut, support is scarce, and those who are struggling are left out to dry. We're seeing psychologists, counsellors, nurses and GPs who are all burning out. Clinics are understaffed and families are falling through the cracks. I would, however, Mr Deputy Speaker, like to take this opportunity to thank the many people in my community of Macpherson on the southern Gold Coast, those who are involved with the provision of mental health services for young people, for people of all ages and for people of all backgrounds. They do incredible work in keeping our community's mental health where it should be and encouraging it to go in the right direction. Mr Deputy Speaker, I also point out in particular the fact that the mental health record for men in this country is shocking. Men are 3 times more likely to die by suicide than females, and they unfortunately make up 3/4 of all suicides. The previous speaker that spoke on this subject mentioned everything that government should do, all the responsibilities of government in relation to mental health, in relation to health more broadly as well. And what I would say is to that member is that member forms part of the government. There is an opportunity here for the government to do something about this. We went to the last election committed to doubling and restoring, rather, the 20 subsidised places for mental health support sessions. And that is something that was very well received in our community in Macpherson. And why was it well received? It was well received because people on the ground, the everyday men and women that I have the opportunity to speak to and I have the privilege of representing in this place, they understand that this is a serious issue at the moment, not just in Macpherson but across the country. The schools that I go into, with the rise of social media, we're seeing it at a very young age, instances of young people being affected by what they're seeing online, by the way that they're being treated online, and that transitioning into broader mental health issues for them. Deputy Speaker, something needs to be done. And if there's one thing I know from my engagement in my community, it's that what is happening in this building by this government is unacceptable. We need to step up, and the government needs to step up and provide where there is a need. And right now there is a need for better funding for mental health support services in Australia. Deputy Speaker, as I've mentioned, mental health needs to be a national priority. And the test of a government's commitment is not the number of their empty promises. It's whether in a moment of crisis an Australian can get the support they need. Mr Deputy Speaker, when I was elected to this place, I committed in my maiden speech to giving a voice to the people of the southern Gold Coast when they need it. That moment is now. People in Macpherson, people across the Gold Coast and people across Australia know well and truly that mental health is something that needs to be prioritised by this government. And us on the coalition side will continue to make noise, to continue to represent our communities where this need, for as long as this need remains. Right now, far too many people cannot access the services that they need. That is the measure that matters, and on that measure, this government, the federal Albanese Labor government, is failing.